Good evening to everybody. Thank you for attending. Again, thank you to Clorox Healthcare for putting this together, especially it's an important time right now. I think we're all concerned about how to practice safely during the COVID-19 pandemic period, but also how to practice profitably. I'd like to give you a few tips tonight, just how to do that, because, it has become a little bit more expensive to practice. Some of our costs are up, some of our patient flow is down, and got some ideas maybe to make things a little better for you. Just to give you a little background on me, I am actually a practicing dentist, so I live this stuff just as you do, and I'd really like to help my colleagues out. Now, what we want to do tonight is talk a little bit about epidemiology of COVID-19, go over the latest COVID-19 guidelines, things that have come out from OSHA, as well as from the Centers for Disease Control. Again, reviewing signs and symptoms of the disease so we know how to screen patients, how to recognize the disease, know just how this disease is transmitted, and also know how we can prevent that transmission through work practice controls, engineering controls, all things that are part of OSHA compliance anyway. Know how to pick the appropriate personal protective equipment. In other words, when do you need to use a cloth face covering versus a face mask or an N95 mask? We'll go over that and what some of the requirements are if you are going to use an N95. Also, to develop a plan for your own office, your own region, and probably most important, to understand the OSHA requirements as well as CDC guidelines that affect you to keep you out of trouble, to keep you safe. And then we're going to go over, again, best practices for infection control during this pandemic environment, and also know the most cost-effective ways to get through it, where, according to most statistics, including the ADAs, most practices are down probably close to 20%. And it's always tough when you take 20% off the top line of a business. Now, actually, what the government really requires is that we should develop and implement policies in accordance with federal, state, and local regulations, and informed by industry best practices. So we'll talk about those best practices for dentistry tonight regarding social distancing, sanitation, disinfection, things that we need to do to practice safely. Now, we'll go over these best practices, but again, you need to keep an eye out on your state and local public health department to see just what type of transmission you have in your area. Most areas of the country are experiencing here what they call minimal to moderate or substantial transmission. And if that's what's going on, and that's what's going on really in 95% of areas in the US, you can do elective dental care. I think everybody I'm talking to here can do elective dental care as long as you're doing it on patients not suspected to have COVID-19. And again, regularly consult state and local authorities as well. I always like to keep every day an eye on the numbers in my county, in my area, just to see what's going on regarding community spread. So one thing that sometimes people confuse is OSHA's role. OSHA is really not concerned about patients. That's CDC. But OSHA is really concerned about the workplace. They're concerned about us. They're concerned about assistants and hygienists and our front desk staff and the doctors in the office. That's what they're all about. And OSHA has announced that they're going to conduct more on-site inspections in 2020 and 21 because of concerns about COVID-19, concerns that they have, as well as concerns that employees have. They've also announced recently COVID-19 is what they call a reportable illness. Now, that means that if a case of COVID-19 comes from a dental office, in other words, an employee gets a work-related case of COVID-19, and it involves hospitalization or any treatment other than just taking days off, in other words, things other than quarantining, it needs to be reported to them. OSHA needs to know. But the good news, and you'll hear me mention it a couple times during this presentation, dentistry is a pretty safe place to be if you're doing the things we'll talk about tonight. At this point in time, there have been no reported cases of COVID-19 coming out of a dental office in the United States or Europe. So you think about that. That's something we should be very proud of is members of the dental profession. So, in one sense, nothing's new. Following OSHA regulations and CDC guidelines, it's always been important. And one good thing, it's hard to find good things that have come out of COVID. But one good thing is it's made people a lot more aware about regulations, including not just the new guidance, but existing regulations to protect the dental team. So we're talking about more OSHA training is being done, more infection control training is being done. It's also important that we continue to do this on a regular basis now, and even once this pandemic period is through. I think we're going to hold ourselves to a higher level of infection control. And on that note, make sure you schedule your annual OSHA training for all your staff members. So let's just go over a little bit basics. I know most of us know this, but surprisingly, there's some people who don't. We all know, I think, though, that SARS-CoV-2 is the virus that causes the disease COVID-19. It emerged in China in December of last year. And it's primarily spread when people cough, sneeze, or talk. So we're talking about respiratory droplets. Although it has been shown to persist in aerosols and on surfaces, that doesn't seem to be the way it's transmitted. It's really transmitted when these droplets, which are larger particles, land in the mouth or nose of another person or inhaled into the lungs. So it requires close proximity. And I think that's why we haven't had a case coming out of a dental office yet. Now, again, it's not considered a main way of transmission, but it may be spread by touching contaminated surfaces, like, doorknobs and armrests and inanimate objects in the dental office. And then people touch their nose or mouth or eyes and inoculate themselves. Again, it's reassuring to me to know that airborne transmission from person to person over long distances, it's unlikely. We haven't really seen that. But remember, it is a new disease. Okay, there's still a lot. You can say this even after a year. It's a new disease. And we're still learning things about how it spreads. People ask me all the time, because our company trains people and has for many years in OSHA compliance and infection control. They want to know, is it a bloodborne pathogen? It's not. It's really considered a respiratory pathogen. It's spread through respiratory secretions. But as OSHA says, the bloodborne pathogen standard offers a framework for minimizing exposure, and it needs to be followed. So you definitely want to do all the things that we've learned in the bloodborne standard, because those things are going to help keep you safe from SARS-CoV-2 as well. Signs and symptoms, it's always good to review them, isn't it? Just to make sure. Shortness of breath, loss of taste or smell. That seems to be one that's pretty consistent in anybody I've talked to who's had COVID. Persistent pain or pressure in the chest, fever, headache, cough, chills or shaking with chills, muscle pain. And remember, anybody who develops these signs or symptoms, they need to seek medical attention. And remember that COVID-19 can be spread by people who don't show any symptoms at all. And it's interesting, a good friend of mine has COVID-19. He got it because he takes care of his elderly mother. His elderly mother, they were being very careful with her, unknown to the kids. She's 86 years old. She's still kind of vain. So she, on the QT, called her hairdresser and asked her to come in and do her hair, because she hadn't had her hair done in some time. So she came to the house, did her hair, and called 2 days later to say she'd been diagnosed with COVID-19. Sure enough, this 86-year-old woman came down with COVID-19. Her two children who were taking care of her developed it too. But just to show you how different it can be, she was hospitalized for 2 weeks on oxygen. She's finally home. She survived it. Her daughter, who's only in her 50s, was in the hospital 1 week. And my friend said it felt like a cold, not even a bad cold. So there you go. Who's at highest risk? People over the age of 60. But as we learn more and more, it's also the main thing is pre-existing medical conditions, comorbidities like diabetes and high blood pressure, heart disease, lung disease, People are on immune suppressant therapy, being treated for cancer, for example. As I said, and this is such good news, I hope it stays this way, and that's why I think this education is so important. We do not want to have any clusters reported out of dentistry. Can you imagine the news to the public if a case came out of a dental office? We don't need that. Things are already a little tougher during COVID-19. We don't need those kind of headlines. We need to keep it like this. Nothing's come out of a dental office. We can perform all the procedures that we need to do, but appropriate PPE needs to be made available if we're going to do this treatment. And we'll talk about that a little bit tonight. So to prevent transmission, of course, update medical history each time. And of course, I suggest doing it remotely by phone or video to make sure that there's not any symptoms that might lead you to think they could have COVID-19. And of course, you want to screen patients when you confirm their appointments. And even once they arrive, you need to do it a second time. Have you been around anybody who's had a confirmed or suspected case? Have you exhibited any symptoms? And all the symptoms that we just went over, ask them that. Let them know ahead of time, too. There'll be a special screening performed when they come to the office. Let them know they need to be wearing a mask or a cloth face covering if they're going to be allowed in your facility. Kind of prep them for what's going to be occurring when they get there. And you'll see at the Compliance Training Partners website, compliancetrainingpartners.com, there's a COVID-19 Learn More button. And there's a pandemic period questionnaire there. Feel free to download it. Good questions to ask your patients. So, of course, if anybody answers yes or even maybe to screening questions, they need to contact their physician, the public health department. They need to reschedule. It's just not worth it exposing everybody. Treatment needs to be provided if they in fact did have COVID-19. A treatment needs to be provided in a place that has what's called airborne precautions. And I don't know of any dental offices that have that. We're talking about negative pressure isolation rooms. If somebody does in fact have a true emergency, they need to be treated. Again, you can't treat them in your office. Work together with the local hospital, with medical providers to find such a facility. There are some hospital-based dental facilities that do have negative air pressure rooms. Also, remember that if you suspect a case of COVID-19, it is your duty to report it. I actually see a couple questions. I'm going to answer a couple of them as we go along. Someone had asked here, because I hear about this a lot, I'm using a hypochlorous acid generator with an electrostatic sprayer in the office. Can I use hypochlorous in water bottle of an ultrasonic scale, and at what concentration? Also, is there a rinse solution I can use at the end of the day to prevent rust? I will tell you that I don't use hypochlorous acid. I've read plenty about it. I think I would probably talk to the manufacturer of that generator. I don't really have any answers there for you. Other than this, I will tell you, if you're using hypochlorous acid, you still have to follow all the guidelines that we're presenting in this program. Now, what if somebody gets through the screening? Somehow you've done all the screening, you've done it online or on the phone. Somebody is in your facility and you realize they may have COVID-19. They have symptoms. What do? Right away, place a face mask on them, send the patient home if they're not acutely sick. If they're acutely sick, get them to a medical facility. In other words, have a facility in mind already. Local hospitals, infectious disease department, but have that number, address ready to go. And again, if dental treatment's urgently needed, even if they're begging you can't treat them in your office. You need to refer them. Now, there are patients, and we're going to be seeing more and more of this, that actually had COVID-19 or they've had symptoms of COVID-19, and they were directed to care for themselves at home. And they can discontinue that isolation and go out and come to your office, for example. if they meet the following conditions. First of all, at least 10 days have passed since symptoms onset. That's very important. Also, at least 24 hours have passed since their fever has broken and they're not using Tylenol. If they're using acetaminophen and their fever's down, that doesn't count. It has to be 24 hours, no fever, without using acetaminophen. Also, their other symptoms have to have improved as well. Now, what you want to take a look at too is this document that you'll find actually at the Compliance Training Partners website. Discontinuation of transmission-based precautions and disposition of patients with COVID-19. You want to make sure you follow these carefully. And again, they're there. You can read them. You can download them before you see patients who say they've had COVID-19. Now, I will tell you that I did a webinar recently, and this was a private webinar for State Dental Association, and we had polling on it. And when I asked the question, how many of you have treated patients in your office that say they've had COVID-19? I believe it was about 50%. So there's enough COVID-19 around that we're seeing people now who've had it, 2 months ago, 3 months ago, maybe 10 days ago. So make sure you ask these questions. So what do we recommend to prevent disease transmission? Have a gloved assistant greet the patient at the front door after they text or call from their car. So again, the waiting room really becomes the car. Record the patient's temperature. Important to do that you actually record it in their record. If it's anything greater than 100 degrees, even if they're begging you to get that cleaning, they need to be sent for a medical evaluation. Advise the patient not to touch anything in the office, and of course, they already should know, but remind them they need to wear a face mask or a cloth face covering at all times when they're in your office, except when you're actually treating them. And have the patient use an alcohol-based hand rub like this before they walk through the office. Try to have only one patient in the waiting room at a time, or if possible, none. Have them walk directly into the treatment room. I can tell you that I'm going to say in our office, through careful scheduling, I'd say probably about 70% of the time there isn't anybody in the waiting room. Every now and then I see one person, never more than that. When they come in for treatment, make sure they use a pre-procedural mouth rinse with an antimicrobial product. A lot of people ask me, what's the best one to use? You see, there haven't really been any long-term studies on this. So according to CDC, pretty much any mouthwash has the potential to help. So if you want to use a product like Paradex, which is chlorhexidine, if you want to use one of the over-the-counter essential oils like Listerine, that's okay. It's also suggested to use hydrogen peroxide mouth rinses. It can be diluted 1 to 10. It seems to be effective. Remember that anybody who's accompanying a patient should wait in their car, and I realize that can't always happen, particularly if it's an elderly patient or if it's a small child. But remember, if somebody is accompanying that patient, they need to be screened, and they need to make sure they have the PPE on in terms of a mask or cloth face covering. Remove all your non-essential items from the waiting room. We used to have this beautiful waiting room. I just thought it was gorgeous, the way it was decorated. But now there's no magazines, there's no toys, there's no remote control, there's nothing. And we're just going to have to keep it pretty Spartan at this point. Try to eliminate in-office payments where you can. Try to have those payments done after or before. But when you do have to have them pay, try to do it with a credit card, not to exchange money, for example. And also the front staff need to be wearing cloth face covering, gloves, have alcohol hand rubs available as well. Another important thing, this should be asked of every patient as they leave your office. So they're there at the front desk, they're being checked out. Be sure to remind them if you develop symptoms or are diagnosed with COVID-19 within 2 days of this visit, please call us. It's really important to protect our personnel. So if they've developed symptoms, say a patient calls you. In fact, we had this happen in our office 2 weeks ago. We have a pregnant hygienist. We had a patient come in who actually was the mail carrier for the building. I called a day later saying they'd been diagnosed with COVID-19. What do? We did exactly what we say here on our website, on the CTP website. You'll find this CDC document, healthcare personnel with potential exposure. And what it talks about is what you have to do. And the good news is, if you're doing things the right way, you don't have to shut down your office. We've had numerous people call us at Compliance Training Partners saying, we heard we have to shut down our office. We had someone who was in the office who had COVID-19. The key is, if you're doing the things that we do in this talk about in this presentation, wearing proper PPE, social distancing among staff, you don't have to go home and self-quarantine. You can still work. You simply have to self-monitor. If, on the other hand, you're having contact with people at close distances within the office without PPE on, that's a different story. Now you're talking about having to quarantine and possibly shut down an office. So look at this document ahead of time so you'll know what to do, if you should have a problem like that. So throughout the day, disinfect high-touch surfaces in the waiting room, things like armrests and doorknobs and countertops. And you want to use a disinfectant on EPA's list N. I would really recommend that you go to the CloroxPro.com website. It's a great website. It always has been, in terms of what products you use on what surfaces. But you'll find information there about this. And you can also go to our website where you'll find the EPA's list N or the EPA's website. Put signs in strategic places talking about hand hygiene, respiratory hygiene, cough etiquette. We've always recommended that in OSHA training. And remember that all staff members, you need to self-monitor daily for any type of symptoms of respiratory disease. You need to record your temperature. It actually needs to be recorded on a log. And I want you to do that for liability reasons for yourself and for the business. You need to show that you're doing this. If you have any fever, you display any symptoms, they need to be sent home. They can't work. Also, try to have your treatment room set up previous to the patient entering so that drawers and cabinets don't need to be open during treatment. Remove all loose or non-covered items that aren't in drawers or cabinets. I will tell you that our operatories, I always thought they were pretty neat, pretty clean, medical looking, clean looking, not a bunch of junk in them. But now we have almost nothing. It's amazing how much you can take out of there. And you know what? It really makes our infection control easier. Remember, too, to cover your computer keyboards with clear protective barriers. Change those between patients. Now, at one time, I thought I was going to pull this slide out, talking about dental emergencies and urgencies, knowing what they are. Because early in the COVID-19 pandemic period, PPE was almost impossible to get. And of course, you also the proper PPE, things like N95s, for example, was really hard to get. And also, most of the country, of course, we've been shut down from doing all but emergencies and urgencies. I'm sure you all remember that. Here in Michigan, we weren't really able to start doing the things we wanted again until June. But the reason you want to know about emergencies and urgencies is PPE is becoming tough to get again. You may get to the point where you have to prioritize who you treat and who you don't. And if PPE is not available, you're going to have to narrow down who you're going to treat. I hope that doesn't happen. Remember, too, that even with all the high-tech disinfectants we have out there and all the cool things that we have, the most important way, or one of the most important ways of preventing disease is, of course, hand hygiene. Always remember, this hasn't changed. You perform it before and after each procedure. I'm a real fan of alcohol-based hand scrubs, by the way, which you see on the right. And, of course, antimicrobial soaps on the left. But I really like alcohol hand rubs. Why? Because people use them. People use them because they can quickly get their gloves on again. Their hands are wet. They tend to stop washing their hands sometimes. Some of the recommendations that the CDC has for hand hygiene are related. Not having artificial fingernails, because that's a great place for things to grow. having short, smooth fingernails, not wearing sharp jewelry if it's going to pierce your glove. As I say, this girl has too big of a diamond, pierced her glove. That's the kind of jewelry you shouldn't be wearing. Have alcohol-based hand rubs in multiple locations throughout your office, in the waiting room, in the hallways, at the front desk, bathrooms, every place you can. But remember that hands do need to be washed with soap and water if they're visibly soiled. If you've got visibly soiled hands, you splash blood or saliva on them, you can't use alcohol hand rub. You need to wash with soap and water. The same if you've directly contacted potentially infectious material. Also, before and after eating, you stop and think about it. You've got alcohol hand rubs, which contain chemicals. I don't really want to see you washing with that and then going and grabbing your sandwich. So soap and water before and after eating. After toileting, soap and water. And of course, before surgical procedures, using an approved surgical scrub. It's important also, according to CDC, to know how to properly put on and take off personal protective equipment. That's called donning and doffing of personal protective equipment. Now, rather than show you this tonight, I'm going to refer you to our website where I've got 2 excellent videos from the CDC, one on how to put it on, one on how to take it off. And this has always been important, and it's always been a requirement, but even more so during COVID, because improper donning and doffing of PPE can be a way to spread disease. So leave all your protective clothing in the office for laundering or pick up by a laundry service. And during this pandemic period, protective clothing should be changed between patients. Now, I'll tell you that in our office, what's really hard is to do that when you're working in an operatory. We have 3 hygienists. You're going to check hygienists. Taking off clothing, putting it back on. So what we do is we wear, for example, it's a long sleeve, high necked, long lab coat to work on patients, washable. Between patients, we put on disposable gowns. So that way we can just put on a disposable gown right over the clothing we have and then go right back into the operatory. So don't wear your protective clothing in the eating areas. Remember to take it off. So change it between patients or cover it, and don't wear it into eating areas. Anything you're going to launder, and this is even pre-COVID, needs to be in a bag like this, a fluid-resistant bag with a biohazard label on it. Remember that gowns are required for any aerosol generating procedure. And even before COVID, it's really been required to have long sleeve, high neck clothing when you're generating aerosols. As I mentioned, disposable gowns are a real good choice, particularly because it eliminates laundering. But to me, even more than that, it allows me to move a little bit quicker, because when I had to take off on snap or on zip a washable gown between patients, it was taking forever. So let's talk a little bit about cloth face coverings versus face masks. A face mask or cloth face covering has to be worn at all times when you're in the office. That includes the business staff. So business staff, you can wear cloth face covering instead of a face mask. That's not a problem. Dentists, dental assistants, hygienists, you can even wear cloth face coverings to save masks. But as soon as you go to direct patient care, now you need to switch to a surgical face mask or a respirator if it's something you're doing that generates aerosols. And I'll go into a little details here in a couple slides about masks, because surgical masks are regulated by the FDA and they have to meet certain guidelines. But the good thing about surgical or cloth face coverings in my mind is it can preserve surgical masks. So what I like to do is use a cloth face covering whenever you can, so you can save the surgical mask and the respirator for when you need it. But remember, cloth face coverings need to be changed if they become soiled, if they're damp, they're hard to breathe through, and they need to be laundered every day. So you're going to need a few of them. Everybody needs to perform hand hygiene before and after they touch their cloth face covering, because let's face it, they probably get contaminated. And again, you can't wear them for direct patient care. So what do surgical masks, what's the difference? What are the different levels of them? Well, there's an organization called ASTM International, and they have performance criteria for masks. And they go through a lot of different performance criteria, but to me, the most important that apply to us are bacterial filtration efficiency, BFE, and also fluid resistance, because we often work in a moist environment. So if you're going to be called a medical surgical mask, like you buy from your distributor, you have to have a minimum of 95% filtration of bacteria aerosols that are 3 micron sized or larger. Now, level 1, they filter out 95% of these aerosols, or of these 3 micron aerosols with low fluid resistance. Level 2 and level 3 filter out 98% of these aerosols, but level 2 has moderate fluid resistance, level 3 has high fluid resistance. So in dentistry, I really recommend level 2 and level 3. Now, do you need to wear an N95 mask? Well, an N95 mask is really a respirator. The difference between a respirator and a mask is a respirator has a tighter seal. So it's really designed to protect the operator, where surgical masks, for the most part, I mean, they do protect us somewhat, but they're really designed to protect the patient. So there's some pretty strict requirements. If you're going to use a respirator like an N95, you need to have a written respiratory protection plan, fit testing, and a medical evaluation of anybody who's going to use them. Now, I can make this easy on you. On the Compliance Training Partners website, there is a respiratory protection plan written specifically for dentistry. Go ahead and download it, fill in the blanks. Fit testing. You can call your local occupational medicine clinic. Google up occupational medicine clinic. You'll find one, they can do fit testing. You can also buy fit testing kits from companies like 3M and do it yourself. It's not hard to do. That's what we did. And regarding medical evaluations, those can be done online. 3M's website is a great spot to do that. So during the COVID-19 pandemic period, you need to be using N95s if you're doing aerosol generating procedures. That means if you're going to run a high speed, a low speed, an ultrasonic, if you're going to use your air water syringe, you need to switch to an N95 because these all have the potential to generate aerosols. But again, remember, we're talking about people who've been screened, because even if you're using an N95, you can't work on patients you suspect have COVID-19. Refer again to our website, the respirators versus surgical masks, to really get a good education on that. So when you enter an operatory, the patient's been screened, you're quite certain they don't have COVID-19. You need to wear a surgical mask and eye protection. Now that eye protection could be goggles and safety glasses with side shields, or a full face shield if you're not doing aerosol generating procedures. But if you're going to do an aerosol generating procedure, now you need to go to an N95 to replace that mask, and you need to go to a face shield to protect those safety glasses, or to replace those safety glasses. In my case, I use a shield that goes over my loops. Now, face shields, they protect the eyes, the face, but they also protect the N95 from moisture contamination. And so you'll want to make sure you're cleaning and disinfecting that eye protection according to manufacturer's reprocessing instructions. Normally, you can use, there's certain disinfectants that are designed to be easy on glass and plastic, or disinfecting soaps. But again, just look at the manufacturer's instructions for use. And of course, don't forget the patients. The patients need protective eyewear as well. It's the standard of care. Now, we all know about gloves, but remember, sterile surgical gloves need to be used for surgical procedures, non-sterile procedure gloves for anything else. And the only gloves that can really be reused would be these heavy-duty utility gloves. That would be the only type that you could use. Anything else needs to be thrown away between patients when they're torn or damaged in any way. Now, work practice controls have always been important, but they've been particularly important according to OSHA and CDC during this pandemic period. So some of the things you can do to prevent spread of disease at work: encourage sick employees to stay at home. So in other words, you need to have flexible, non-punitive sick leave policies. You need to minimize contact between employees at work. Back in the lunchroom where we used to have 6, 8 people eating, we now only have 2, and they have barriers between them. And encourage work at home arrangements. I know that's not easy in dentistry, but sometimes you can have things like full staff meetings via Zoom or something like that. Minimize the use of saliva ejectors. Backflow can be a problem, a potential source of cross-contamination. Minimize the use of air water syringe. That creates aerosols. I'd maximize the use of high volume evacuation and anything that connects to it, like an isolite type device. And of course, four-handed dentistry, because anything that involves suction with HVE can dramatically decrease aerosols as much as 95%. Use a rubber dam where you can. Again, minimize using aerosol generating procedures or performing them when you don't have to. We've eliminated in our office the use of the ultrasonic scaler by the hygienist during this pandemic period. We'll go back to it, but not yet. By doing so, we've been able to have an aerosol-free hygiene visit. And our hygienists appreciate this. The patients understand it when you explain it to them. And of course, always remember to avoid touching your eyes, nose, and mouth. That's always been important, but particularly now until after you've removed that PPE and performed hand hygiene. Now, engineering controls. This is any type of engineered or mechanical device that can make the office safer. And I'm going to talk about some simple ones that won't cost you a ton of money. If you have an opening window in the operatory, put a small fan in it, place it so it's pointed to the outside. In other words, it's evacuating air from that operatory. Also, turn your heating and cooling system fan to on during working hours. So now you get a number of exchanges of air, fresh air per hour. Typically, most heating and cooling units, 6 to 8 per hour. If you have local exhaust devices like clean air machines, those are good. They're not required, but they can make the air quality higher. And one of the things I like that OSHA talked about is what they call directional airflow. They say, use things like fans to direct air from staff work areas towards patient areas, not the reverse. In other words, small fans that would go pointing away from the kitchen, away from the break room, away from the private offices, towards the operatories, not the reverse. And I'll show you just some simple, inexpensive ways we've done this. Here's some cheap Costco fans. These are our operatories. The fans are turned on low. They gently move the air down the hallway from the operatories. Behind us would be the kitchen and the doctor's private office and the staff break room. So these fans are directed away from that. All the air is moving down the hallway, away from areas we eat and gather. It slowly goes down the hall, finally culminates in the last operatory, and there you see a fan pointed to the outside, blowing air to the outside, evacuating that air. And that's, probably for 4 fans, a $100 solution. Some other things you can do that are inexpensive and will really make the office safer. Run your bathroom vent fans and your kitchen vent fans, your restroom vent fans, your lab vent fans full time during this pandemic period. Something that's not too expensive and easy to do, talk to a heating and cooling professional. Often these heating and cooling guys can come in and increase your airflow, increase your outside air source. They can put a better filter on. These are things that are not expensive to do. If you have operatories with partitions or walls between them, try to use those. If you have only wide open operatories, consider curtains, things that you can easily decontaminate, some barriers between them. And of course, plexiglass shields like this up at the front desk so that you're not directly contacting the patient and the front desk personnel. This is some simple upgrades to a furnace, a UV disinfecting unit on the furnace, on the cold air return, a better filter that goes on the furnace. All things you can do that are inexpensive. I don't think you need to spend, $5,000 per operatory for a clean air machine. So when staff enters the office, they need to perform hand hygiene. And of course, they need to be wearing a cloth face covering the second they walk in the door. And they need to wash their hands before and after leaving the workplace. Remember to have signs like this throughout the office. Strategic places, the waiting room, break rooms, hallways. Provide tissues and no-touch receptacles. Have alcohol hand rubs throughout the office. So we've always said that, even pre-COVID. For environmental surface disinfection, clean and disinfect with an EPA-registered hospital-grade disinfectant on your clinical contact surfaces, things you touch in the operatory. But make sure you're using something that's been approved against SARS-CoV-2. Now, again, as we all know, SARS-CoV-2, that's the virus that causes COVID-19. Again, on the CloroxPro.com website, there's some good information about this. Also, again, as I'd mentioned on the EPA website and on our website, this List N. you're going to find that, well, for example, I know that all of the Clorox products that we use are all on this list N. They're effective against SARS-CoV-2. So remember to follow the instructions. And this is before COVID, during COVID, and after. Read the directions on the bottle. Make sure you're using them for the proper contact time. So clinical contact surfaces, these are the things that are likely to have spray or spatter or instrument contact or contact with the gloved hand. That's where you need to use an EPA-registered hospital disinfectant that has a TB claim and is on the list N. Barrier wrap where you can. And if a COVID-19 patient does end up in your operatory, the CDC states you need to clean, disinfect, or discard surface, supplies, or equipment located within 6 feet of the patient, which is why I want you to do a really good screening so you don't have to do that. Clinical contact surfaces, actually, this is actually a misprint here. This would be environmental surfaces. Clinical contact surfaces are what I just read. Environmental surfaces include floors, walls, unused counters. These have limited risk of disease transmission. There you can use an EPA-registered low-level disinfectant. Remember, for instrument sterilization, follow CDC guidelines as always. In other words, your sterilization area should be divided into 4 distinct areas. And when I say divided, it can be something like, I don't have that picture there, but it can be divided by just saying left of the sink is receiving, cleaning, and decontamination. Right of the sink is prep and packaging. Obviously, once you hit the autoclave, that's sterilization and then storage. In other words, people need to know where clean instruments go, where sterile instruments go, and that's where you can get into trouble in the sterilization lab. Instruments need to be thoroughly cleaned before sterilization. Remember to use internal and external indicators in your sterilization packaging. And also remember, if you're in a hurry, if you're lacking for instruments, you can't be interrupting the drying cycle because then the packages are wet, they'll tear, and they're no longer sterile. Remember, too, weekly spore testing of all your autoclaves and any of your dry heat sterilizers is required. Another thing that CDC emphasizes during the pandemic period as well as before is your dental unit water. How clean is your dental unit water? Because without proper maintenance, this is what a test can look like, growing lots of bacterial colonies. We actually take pictures, mark the operatories they come from, and then document that our water is good. Because the CDC states dental unit water needs to be less than 500 colony-forming units of heterotrophic bacteria per cc of water. The ADA goes further, and they set their goal at 200. In Europe, the standards are 100 colony-forming units. And I can tell you that if you follow the proper protocol, it's not difficult to get below European standards. It's not difficult at all to get below 100. But remember, if you don't, dental unit's perfect for growth. It contains small diameter tubing, biofilms form, and even a brand new unit in about a month. If you're not taking care of it, it'll definitely exceed levels of bacteria. And keep in mind, major lawsuits have been filed by patients against dentists and dental offices with high levels of bacteria. So I want you to do these things to protect your business. I want you to protect you, of course, and your patients, but I want you to protect the health of your business as well. Which is why make sure you're doing the spore testing of all your sterilization machines weekly, and keep these spore testing logs for 3 years. So should a patient wrongfully accuse you of giving them a disease, I want you to show that you're doing all these things the right way. I want you to be able to produce your spore testing logs. Because if you have a positive test, in other words, it doesn't kill the spore, you can't use that machine. It needs to be shut down. It needs to be retested. That's why you need to have a backup sterilization capacity. If that device fails a second time, that's where you need to recall those instruments. You can't use those instruments that have been run through that machine. Your evacuation system, important to maintain this. It can cause costly repairs. The EPA says you need to use a neutral pH product. Consider something that's bacterial based. And I always instruct the staff, start from the farthest operatory from the suction pump and work through one at a time, aspirating through the high volume and the saliva ejector. Just an incredibly expensive thing when these lines get clogged up, or the lumen gets narrower and narrower and narrower. And sometimes these lines are under the floor. They become very costly to repair. Now, staff training, obviously I'm preaching to the choir. You guys are all on here training tonight, but the dental team does need to receive training, according to CDC and OSHA, on when to use PPE, what PPE is necessary, how to dispose of it, how to put it on, how to take it off in the proper order, which is, again, why I'll refer you to the website. That'd be a great training session for you next week. It only takes a few minutes. How to dispose of it, the limitations of it. In other words, okay, a cloth face covering is great, but it's not for patient care. A level 2 mask is great, but it's not going to protect you that much if you're generating aerosols. So, there's a lot of good news, though. We're doing a lot better than a lot of professions. I think it's really important to know that for your patients to know what you know. There have been no clusters of COVID-19 coming out of a dental office. But let your team and your patients know you're monitoring the situation, you're following OSHA regulations, you're following CDC guidelines, you're attending webinars like these. But make sure your team has the information they need too, especially sometimes people will ignore people at the front desk thinking they're not clinical people. But you know what? Patients are scared. A survey that I read recently showed that as many as 25% of our patients are delaying dental treatment because they're scared to come in. So when they call your office, that front desk person needs to explain your infection control program as well as your hygienist or your assistant. And of course, let your staff and your patients know safety is prime importance in your office, via email, via newsletter. The practices I talk to that are doing well, the production and collections are good, are doing these things. They're communicating with them, letting patients know that it's safe to come, because patients need our services. They need to come in. Although you might think this is really out there, I've talked to a few dentists lately who said, you know what? I'm using this low interest rate environment to acquire a new practice or to enlarge the one I have because cheap money is available. It could be a good time if you're contrarian to grow your business because it's going to come back and it's going to come back strong. And patients trust us. They've been coming to us for years. They're used to us using PPE. I can't tell you how many of my patients have said, I wasn't scared to come back because, you guys always wear masks and these gowns and, they felt safe there. They didn't see that in other environments. So we do have a good story to tell. So get out and tell that story. We really do have a good story to tell. Now, during the early part of COVID-19, keeping current I was actually changing the webinar every week. I'm used to changing a webinar I do or seminar once a year. I was doing it every week. It's gotten to be a little better than that now, but still things change. So do take a look at the website. We always have the most current things on information from CDC, from OSHA. You'll find information there and videos on how to fit test respirators. And of course, as I'd mentioned before, visit the CloroxPro.com website. Lots of great information on not only using the proper disinfectant, but how to use less of it, how to preserve things. Because as you know, for example, things like wipes are becoming more difficult to come by. So take a look at this. I think you'll find some good information. Now, one thing that is good here is we're not just going to drop you and disappear into the ether after this. If you have questions we can't get to tonight, or questions that come up, you can contact our technical services number, and we're certainly glad to help you at any time. Just identify yourself as having been on the Clorox webinar. Okay, some questions that we have here, a number of questions. How do you differentiate a normal cough from a COVID-19 cough? And is wheezing a possible symptom of COVID-19? What's interesting from all the infectious disease people I consult with, That's the difficulty, is it could be a very small, subtle cough. It could be a wheezing cough. It's kind of like that story I told you with the 3 family members, one in the hospital for 2 weeks, one in the hospital for a week, one had nothing, not even a cough. So it's really hard to say that it's a COVID cough. Here's someone asked, I noticed that the dentists wear N95 and surgical masks together and face shield. Is it enough to prevent catching COVID? Here's what I will say, is that, first of all, a respirator is, you all have probably worn one. An N95 respirator is very tight fitting. Again, that's the definition, the difference between a respirator and a mask. A mask might have very good material for filtration, but it doesn't have that tight seal around the face. A respirator like an N95 does. I will tell you that, would I work on a known COVID-19 patient with an N95? By the way, you can't do that. I don't suggest that. Would I do that? No. Do I feel comfortable, though, that if a patient, I've probably seen somebody in the last 6 months that had COVID-19 and I didn't know it. They were asymptomatic. But neither I nor my staff have contracted COVID-19. So do I feel N95 protects against it? I do. Someone asked a good question here. Where do you refer a patient who needs emergency treatment if they're sick and they're in your office? If we're talking emergency dental treatment, what I would do is again, you need to get them out of that office. You need to refer them to a local hospital or medical center. I would contact that medical center and work with them to identify a hospital-based dental facility that has a negative air pressure room. They do exist. Now, someone said here, I recently left an office where I worked for nearly a decade and never once did the doctor do OSHA training at the office. Is it an annual requirement for dental offices? Well, actually, it is. And, I'll tell you, that's one really good thing, I guess, about COVID. It's hard to find good things, but I'm trying to find a silver lining, is that people are more aware of the need for infection control training and safety training. But yes, it is a requirement. And staff who are on here, one thing I'll really encourage you to do, really offer to help your doctor with it. The offices that are in compliance with OSHA, that do annual training year after year, they've put a trusted clinical employee in charge. So a hygienist, an assistant, somebody who makes sure that that new employee gets trained, somebody who makes sure that that annual OSHA training is done. That's the only problem in dentistry, is we're the CEO of that organization, but we're also working on the assembly line, and sometimes these things don't get done. So help us out, and let's get this annual OSHA training scheduled. Someone says here that they've run into this a lot in their practice. A patient calls and asks if they should cancel because they were with their son, daughter, or a friend at home for several hours over the weekend, and found out their son's best friend has COVID and they were together a couple of days. The staff gets upset and nervous if the patient's allowed in. Otherwise, the patients get rescheduled last minute. But how long do you wait to reappoint? What's the correct way to handle this? Well, it is, from a business perspective, that's really tough, isn't it, when you have to cancel people like that? And sometimes the patient is upset. But the right thing to do there is, if somebody is exposed like that, has potential exposure, here's what the new guidelines from the CDC are. If you are asymptomatic and may have been exposed, in the case we're describing here, you were with your son's best friend, who he was with, had COVID, you're potentially exposed. And what they say is you have 2 choices here before you as a patient could go out in public or go to a dental office. That would be, number 1, you could go 7 days with no symptoms and a COVID test. In other words, you can do it in 1 week. If they don't come into your dental office for 1 week and they get a COVID test, they're good for go. The other option, option B, is if they're asymptomatic, they can go for 10 days without a COVID test and then come in. That's just the latest guidance from the CDC. Somebody said it's a long question, but that's okay, Peter. It was a good question. A lot of people wonder about that. With alcohol or any other disinfectant, how long does it take for the virus to die? Is it immediate or is it a long period of time? Again, there's some really good things. That's why I really encourage you to look at that CloroxPro.com website. But one of the good things is SARS-CoV-2 is not a difficult virus to kill. There are other things that are harder to kill than that. So you can feel very comfortable that if you're using a product that's on that list N, the recommended contact time, let's call it 2 minutes to 5 minutes, whatever it says on there, you can rest assured that it will kill SARS-CoV-2. Somebody said, can we get some free Clorox wipes? I'll tell you, wipes are hard to come by everywhere. My opinion on PAPRs instead of N95. Actually, PAPR stands for Powered Air Purifying Respirator. I tell people, it almost looks like they've got a scuba outfit on, right? This is the mask that goes over your full face, and it actually has as the name implied, powered. It actually has a small battery-powered motor in that filters the air. PAPRs are great. PAPRs are great. They work really well. If you're comfortable wearing a PAPR, I'm really good with that. If you're comfortable wearing an N95, I'm really good with that. Either one will definitely do the job. Just make sure that if you have a PAPR on, it has the right filter. In other words, an N95 filter on it. There are PAPRs that have, for example, organic vapor filters, but you want a PAPR with an N95. For the eyes, you need an adequate seal around loupes or goggles to protect from aerosols that are airborne. You know, the problem is goggles, yes, goggles will really give a good seal. Loupes, it's pretty hard to get a really good seal. And if you're concerned about contact with mucous membranes, aerosol contact with mucous membranes, I think the way to go is goggles or face shield. Is it okay to remove staff face mask in the office? I do not, and I do not think it's advisable. Several staff members remove masks to eat in the office, not 6 feet away from each other, and walk into the office without their mask on. Lisa asked this question. Lisa, that's a really good question, because here's the problem, okay? First of all, if they want to remove their face mask, what they need to do then, if they want to remove that face mask, of course, it's dirty, they need to remove it, but then they need to put on a clean one. And when they're going to intermingle with staff members, they need to have that face mask on. It says staff members remove their masks to eat and they're not 6 feet from each other. That's a big mistake. And here's where the problem is. She also says they walk around the office without their face mask on. If you have somebody come up positive in the office, now you're looking at shutting that whole office down, because you have to answer those CDC questions. No, we weren't wearing proper PPE. So to me, it's very foolish to do that. I'd really encourage them to tell them that they're not only putting themselves at risk, they're putting your business at risk by not following social distancing and not wearing masks. If someone says they have allergies and we notice they have tissue in their hand, what do? I would question them further. Because you're right, a lot of people have tissue in their hand. We don't want to get too paranoid. Maybe you find out they have a 5-year history of allergies. Maybe you find out they've had a recent COVID test, but dive deeper into why they have tissue in their hand. A staff member's husband exposed to a close friend who has COVID, and the staff member is worried about coming to work. What should you do? Here's what I would say. I would kind of go back to that question I answered earlier. This would apply. So I would describe this staff member as someone who potentially was exposed to COVID. Now, if that had happened at work where they had their PPE on, that's a whole different story. I would say they just self-monitor, they continue to work, no problem. But if they were exposed to their husband, and I'm assuming they have a good marriage, they don't wear PPE when they're around each other, If she was exposed to her husband and her husband was exposed to his friend without PPE, she should take that option that I stated. 7 days, not at work, get a COVID test, then report for work if that test is negative, or 2, stay away from work for 10 days. In an orthodontic clinic, they ask in a totally open environment, can you APG safely with proper PE? You know, in an orthodontic clinic, I would have no problem with doing the procedures except if you're creating aerosols. So if you're, for example, some orthodontic offices will use a high speed for different things, whether maybe they're doing interproximal stripping, maybe they're removing cement from a tooth. But if you're creating aerosols, I would create one room where it's not open. Maybe you have to get portable barriers put in, but have one room where you would do that type of work. The other things you're doing, taking off wires, cutting wires, placing brackets, things like that, no problem. You don't have to be concerned. If anyone in the office tests positive for COVID, are we required to inform the patients, or is that a HIPAA violation? Well, actually, here's a good thing, and I just want to mention here, we'll be able to just go a couple more minutes on questions. We have a ton of questions. But the good news is, again, you have the Compliance Training Partners number, so you feel free to contact our technical services people. We have 4 authorized OSHA trainers on staff, and we were glad to help. It says, if anyone in the office tests positive for COVID, are we required to inform patients, or is that a HIPAA violation? Well, here's what you would want to do. You would want to, again, take a look at our website, the COVID Learn More button, where you'll find information if that exact thing happens. The good news is this, probably not if they were wearing the proper PPE. But in this case, they're going to advise you to contact your state's public health department, again, if you have a healthcare worker who is positive for COVID. We wear an N95 mask and a level 1 over it. We save the N95 mask and use it again in 1 week. Is that acceptable? Here's what you have to understand, Jennifer. If you do that, you have to realize that you're out there twisting in the wind a little bit legally, because that N95 is a single-use item. And there's no instructions for use that say you can put a level 1 mask over it and reuse it in a week. So I guess what we've done in our office, we have one way we really decrease usage of N95 is by having the aerosol-free hygiene visits. Our hygienists don't use the rotary polisher anymore. They polish with a gauze and Profi paste. They don't use the ultrasonic. They don't use the 3-way syringe. So that way they're only having to wear masks. We can preserve the N95 mask for a use down in the operatories where we are doing aerosol generating procedures. Just keep in mind what you're doing is off-label use, not really approved. If a staff member tested positive for COVID-19, how can they come back to work? They can come back to work after again, the CDC website will show you that they need to, first of all, have been off 10 days and present you with a negative COVID test. Do all staff members need to wear N95? No. Just those that are involved in the operatory in an aerosol generating procedure. Now with that, we are going to need to sign off. Again, I don't want you to think we're leaving you out there without answering your questions. Feel free to contact us. We're glad to answer those questions 5 days a week. I want to thank Clorox Healthcare for putting this together. I can tell by the number of questions, we really had a super engaged audience. And I want to thank Clorox for putting this together and being concerned about safety for all of us in dentistry. Thank you to everyone, and good night.